Hi everybody, I'm Melissa Koehl, Doctor of Physical Therapy and Pilates instructor. Today we're going to learn how to stretch the pectoral muscles in the front of the chest. These muscles, when they're tight, they sometimes lead to that feeling of the shoulders being rounded, or sometimes anterior or pain in the front of the shoulder and neck pain. So it's important to have good flexibility here in the pecs. To stretch them, what you want to do is find a doorway, and then you're going to bring your arm to a 90-degree angle, like a goal post position of the arm. Place your palm and your elbow on the other side of the door frame. Stagger your stance, one foot in front of the other. Keep the abs tight a little bit to prevent your back from arching while you do the stretch. So you're going to keep the core engaged, back flat, arm flat to the wall, and then just start to lean forward as you start to also twist the chest away. So left shoulder is going to turn a little bit until you feel a pull here in the front of the chest. Hold for about 30 seconds and then take a break. And then you're also going to do this at a few different angles. So the pectoral major muscle is a big fan-shaped muscle on the front of your, if you can imagine it like this, a big fan-shaped muscle on the front of your chest. So depending on the angle of your humerus, of your arm, you're going to stretch a different part of your pec muscle. So when your arm's straight to the side, it's going to stretch the fibers that are more horizontal across here. And then as your arm comes up, you'll stretch more of the fibers that run more at a diagonal here. So then once I've done this position, I'll take a break, lift my arm up a little bit more, and you'll notice it feels a little bit different. Now, if you feel like you need a little bit more of a stretch, so if having the elbow bent, you're not quite getting enough, you can also do a straight arm version. So same thing, arm either straight to the side, your doorway might need to be a little wider, or you can use a wall, but you hold on, instead of with the elbow, hold on with your arm and bring your chest forward and then start to turn away. Watch that lower back, tuck the tailbone down so that there's no strain in your back. You should feel it in the front of your chest. If you ever with this stretch feel a sharp pain in the front of your shoulder, you want to readjust. So sometimes what happens is if you bring your arm back and if you have too much of an angle at your shoulder, you'll get too much stretch here in the front of the shoulder joint and not enough here in the chest. So that's why it's really important to do that little bit of rotation so that your sternum, the front of your chest bone, rotates a little bit away from your coracoid process, which is this bone here, right in the front of the chest, which is actually the very front part of your shoulder blade. So as you come forward, you're thinking about expanding that space here between the chest and your coracoid process, like so, rather than entirely angling at your shoulder joint, here and here. By adding that little rotation and getting that stretch between the coracoid and your sternum, that'll also stretch the pec minor, which is the smaller pectoral muscle in the front of the chest, especially when you're in this elevated position. So as your arm comes up a little bit more and you get that rotation here, you'll not only be stretching your pec major, that large muscle, the fibers that angle down, but also the deeper pec minor. And that's it. That's how you stretch your pec major and pec minor. I hope you found this helpful. If you have any questions, leave them in the comments below. Be sure to like and subscribe to my channel. If you felt like I was stretching and this isn't quite, it felt like what you needed, but it's not giving you the results that you want, I'd recommend seeing a physical therapist to get an evaluation. I'm available for a free discovery visit. You can contact me on my links below into my website. We can do an online video discovery visit to see what's going on with you, to see what other stretches or movements or things that are going on in your body that will help whatever's causing your discomfort that brought you here today. Hope you found this video helpful, and thanks for watching.